Hello, we did our story on Seconds That Matter, mapping emergency gaps in Houston. We used geographical information systems to identify spatial disparities in emergency response coverage across Houston, Texas. We are Team A with Kristen, Claire, and Itzel. For our case study, or sorry, for our story map, we wanted to highlight emergency response times in Houston, Texas, the really populated area with a lot of suburban traffic. So, emergency situations, time is critical, whether responding to cardiac arrest, structural fires, or violent incidents. Rapid intervention by trained professionals can be the determining factor between survival and loss of life. In a city as expansive and populous as Houston, with its complex transportation systems and varying population densities, ensuring equitable and timely access to emergency services is a logistical challenge and necessity for public safety. I did add this fun little sound in there for emergency
911,
context.
what's your emergency? 911, what's your emergency?
GIS is not just a mapping tool, it's a life-saving tool that helps identify where the gaps in emergency services exist and ensures that no community is left behind. Our project leverages geographic information systems to identify and analyze areas of inequitable emergency service coverage by mapping existing infrastructure alongside demographic vulnerability and estimated travel time. The analysis reveals which communities are most at risk due to insufficient emergency response access. We included a case study in here that shows the effects of inadequate emergency response times and the ability to reach specific areas of Texas and Houston. So in June 2025, a fire broke out at the Independence Hall Apartments, which is a senior and disabled living complex in North Houston. The fire resulted in one fatality and three injuries. At that time, approximately 80 firefighters from 15 stations responded, but the high number of residents with disabilities required focused rescue efforts. One injured individual reportedly jumped from the window to escape. This event underscores the urgent need for accessible, equitable emergency response services. When critical infrastructure is too distant or hindered by traffic congestion and outdated routing systems, the consequences can be devastating, especially for residents who rely on mobility assistance or have limited means to evacuate quickly. This draws importance to our title where it says every second matters in an emergency situation. The following sections analyze the spatial disparity of emergency service facilities, including fire stations, hospitals, police stations across Houston. By identifying these gaps in coverage, our project aims to support strategic recommendations that could help prevent tragedies like the Independence Hall fire from occurring in the future. Oh, one sec. There we go. My map wasn't quite working right. So in figure one, I mapped Houston emergency response locations individually by police stations, fire stations, ambulance facilities, and hospitals in Houston. Figure one to the right displays the geographic distribution of all of these places. This map was made through Google Maps by adding additional layers for each facility. The map provides an overview of the available emergency response infrastructures within and surrounding Houston. Police stations are marked with the orange icons, hospitals with blue icons, and fire-related services with red icons. The visualization reveals a strong concentration of emergency service facilities in central Houston, particularly within and near the 610 loop, where population density and historical development are the highest. The map illustrates areas including the western suburbs of Katy and Richmond, the coastal communities near Seabrook and Texas City, and outlying zones in the north and east show fewer emergency service locations. These disparities in facility availability raise questions about equity, access, and response efficiency in rapidly growing residential areas beyond the urban core. This map to the right sets the stage for deeper analysis in sections of this project. This is an interactive map, and so we can click and see all of these varying substations, their addresses, and everything that's pulled from Google. In figure two, it displays the distribution of emergency facilities within a 120-mile radius of central Houston, encompassing 614 miles of hospitals and emergency response locations. The visualization includes hospitals, police stations, and fire stations marked with color-coded icons for clarity, as mentioned above. The map screenshot displayed in Figure 2 provides a geographic reference for understanding the scale of Houston's emergency response network and the challenges in covering such a large area. Within the central 20 to 30 mile range is a clear concentration of EMS hospitals, particularly near West University and Texas Medical Center and downtown. However, facilities become sparse beyond the inner ring, especially in growing suburban and coastal communities. Areas such as Rosenberg, Seabrook, and northern Liberty County appear to be on the outer edges of service coverage, which could lead to increased response times in critical emergencies. This imbalance suggests a need for expansion beyond central Houston to ensure more equitable access to emergency services across the entire region. Figure 3 displays locations of AED machines, which is automatic external defibrillators, throughout Houston, as registered in the Pulse Point AED registry. For our second presentation in week 7, we did our presentation on Pulse Point, which is an emergency alert system app that agencies are able to register with. So all of these are registered AED machines throughout Houston. Um, each icon represents a publicly accessible AED unit. The map illustrates the geographic distribution of these AEDs, and they are essential for improving survival outcomes in out-of-hospital cardiac arrest, especially when deployed rapidly before emergency medical services arrive. While central neighborhoods such as West University, Bel Air, and downtown show a high density of AED availability, other communities, as mentioned above, these rural, southeast, and far west, appear to have significantly fewer accessible units. The uneven distribution raises concerns about public preparedness in suburban and outlying regions where delayed EMS response times may make AED accessibility even more critical. The map highlights a potential opportunity for targeted investment in AED deployment to enhance community resilience and expand life-saving resources beyond Houston's urban core. Here's another fun sound for play as we lead into active 911 feeds in Houston, Texas, and I'm going to hand this one off to Itzel. Or sorry, I think Claire.
For the crime rate index map displays the 2024 total crime index by census tract across the Houston, Texas region. This map was created using ESRI's GIS crime index layers and visualized with a graduated color scale to highlight areas of varying crime severity. The crime index is a composite measure that incorporates multiple layers of reported offenses, including violent crimes such as assault, robbery, and homicide, and property crimes such as burglary, theft, and motor vehicle theft. Higher index values correspond to census tracts with elevated levels of criminal activity, while lower values reflect areas with safer conditions. The spatial analysis enables a focused understanding of public safety challenges across Houston. By using census tracts as the geographic unit, the map offers fine-grained insights that can support targeted resource allocation and emergency response planning in high-risk neighborhoods. Analysis of emergency response coverage in Houston. As Houston's population grows and spreads outward, ensuring that emergency resources are equitably distributed becomes increasingly vital. A comparative analysis of the city's emergency service locations, including police stations, fire departments, hospitals, and AED units, reveals a critical imbalance in the spatial coverage of life-saving infrastructure. The map layers show that while central Houston benefits from dense clusters of services and AEDs, peripheral regions such as Rosenberg, Seabrook, Katy, and Galena Park show noticeable gaps. In several of these areas, AED availability does not align with the location of emergency service facilities. This mismatch creates potential delays in response times during cardiac arrest or medical emergencies, particularly in regions that already face long travel distances to reach hospitals. Furthermore, the locations of high call volumes on the active 911 incident dashboard frequently fall outside the most well-served zones. This suggests that demand for emergency services is not necessarily aligned with where resources are stationed. These spatial gaps become even more concerning when considered alongside Houston's well-documented traffic congestion. Response delays are highly likely in areas with limited AEDs, sparse EMS facility coverage, and heavy commuter traffic, such as along I-10 near Katy, Highway 288, and Beltway 8 South. may reduce the effectiveness of time-sensitive interventions like defibrillation or trauma care. This section leads into a more detailed spatial analysis of how traffic density, average travel time, and emergency infrastructure interact across Houston. Understanding this interplay is essential for identifying priority areas for future resource placement and service optimization. The map in Figure 5 highlights the spatial distribution of EMS-related facilities across Houston and the surrounding region. The dark red clusters represent concentrations of hospitals, businesses by census tracts based on NICS data. The spatial disparity is especially evident in underserved neighborhoods on the far northeast, northwest, and southern edges of the Houston metropolitan area, where fewer emergency care facilities are available despite the sizable populations. This analysis highlights the urgent need for strategically placed EMS facilities in peripheral regions to balance the load on central hospitals and ensure more equitable response coverage citywide. Traffic congestion, hospital locations, and at-risk populations in Greater Houston. And Figure 6 visualizes the historical traffic count data across Houston and surrounding areas. The most severe congestion is concentrated in the urban core of Houston, particularly around major highways. These corridors consistently show traffic counts exceeding 250,000 vehicles, highlighting them as significant regions for vehicle access. Beyond the city center, elevated track volumes extend along key radial routes, suggesting that only the central business district and outer suburban areas are under strain due to traffic flows. This level of congestion poses significant challenges for emergency response times, as high traffic zones can delay EMS units, especially during peak hours. The map in Figure 7 overlays key factors affecting emergency response efficiency across Houston metropolitan area. Blue circles represent clusters of high traffic congestions, orange symbol marks hospital locations, and shaded census block highlights areas with elevated social and health risk indicators. Notably, many of the densest traffic clusters are concentrated in the urban core and along major arteries such as I-10, I-45, and Beltway 8, which serve as primary routes for emergency services. These routes also coincide with areas where hospitals are concentrated, suggesting that access to care may be delayed not because of facility location, but due to travel barriers. In outlying areas such as Richmond, Rosenberg, Katy, and Seabrook, all of which are included in the analysis, emergency response challenges are compounded. These zip codes contain block groups with many older adults and individuals with disabilities, yet they are located at the urban hospital network's periphery and surrounded by high traffic corridors. In such areas, even short geographical distance can result in delayed emergency response due to bottlenecked routes or limited alternative access points. Emergency response by police, fire, and EMS is impacted in multiple ways. For police response may be delayed in congested areas during peak hours or zones with limited alternative route access. For fire services, especially ladder and engine trucks can struggle to navigate traffic clusters, particularly in densely built suburban or mixed-use area. Ambulance transit may be slowed significantly in areas where traffic congestion overlaps with aging populations or low vehicle ownership households who cannot transport themselves to care. The spatial relationship between vulnerable populations, traffic delays, and facility distance highlights an urgent need to consider mobility data in emergency response planning. Infrastructure investment, alternative dispatch points, or even pre-positioned EMS units could improve response times in these underserved zones.
The analysis on population density that we did show the results emerging from the emergency information infographic in Figure A, key demographics data tools data within a 3 to 5 kilometer radius of central Houston's deadsets. The findings indicate a highly concentrated population, underscoring the need for efficient emergency response systems to serve dense urban areas effectively. Of particular concern is a number of households without access to personal vehicles. These residents may face greater challenges during evacuations or time-sensitive emergencies. emphasizing the need for targeted response planning and mobile EMS deployment. Additionally, the data revealed that approximately 10% of households in Houston lack internet access. This digital divide could prevent a significant portion of the population from reporting emergency or receiving real-time alerts, complicating efforts to coordinate rapid response. Together, these indicators demonstrate that emergency preparedness in Houston must go beyond geographic coverage and account for demographic and technological vulnerabilities to ensure equitable access to life savings. And in rural areas of Texas, such as Polk County, weak infrastructure and limited internet access have made also communication during natural disasters particularly challenging. County Judge Sidney Murphy utilizes a text message system and Facebook page to disseminate information during emergencies. However, the aging telecommunication systems and the geographic spread of communities contribute to difficulties in reaching all residents effectively. These factors can severely hinder the effectiveness of emergency response efforts, leaving residents vulnerable. Identifying areas where residents do not have internet access is crucial for optimizing emergency response. Digital access disparities. In Figure 10, it displays internet access levels across Houston. Red areas indicate high concentrations of connected households, while yellow areas present mixed access where some residents are connected and others are not. Green areas highlight regions with little to no internet access. Limited connectivity in these zones poses a significant barrier to effective emergency communication and response. Residents without internet may not receive timely alerts, locate nearby EMS services, or report emergencies during critical events. Strategically placing new EMS facilities in these digitally disconnected areas could help close this response gap and ensure more equitable access to life-saving services.
I'll go into the next map. The 2024 Internet accessibility data pulled from ESRI reveals significant digital divides that could impair emergency response, especially in rural areas with aging populations and limited healthcare infrastructure, such as hospitals, police stations, fire stations, etc. Counties like B, Texas, have 67.25%, and Jones County, 67.19%, have some of the lowest internet access rates in the state. In B County, only 18.43% use the internet for medical purposes in the past month, and 38.3% rely on mobile internet for information figures that highlight critical gaps in emergency preparedness. Walker and Anderson counties show slightly better home internet access, around 79 to 80%, but still low usage for medical information, suggesting a disconnect between connectivity and preparedness behaviors. This map in Figure 11 shows that these rural counties also have limited access to EMS and hospitals. Combining these with poor digital infrastructure, internet access, this creates a dual vulnerability zone where physical and communication barriers heighten emergency risks. As seen during the winter storm Uri, lack of connectivity left thousands unable to access alerts or aid. To close these gaps, emergency planning must include investments in broadband access, mobile coverage, and digital literacy, alongside traditional infrastructure improvements, again aimed at the rural areas of Houston, Texas. The map, we can highlight internet access between these counties. And then we move on to recommendations.
Optimizing emergency response efforts in underserved areas of Houston, Texas can greatly enhance public safety and reduce disparities in service accessibility. The GIS analysis showcased throughout the story map reveals clear spatial patterns of risk congestion, and limited EMS coverage that informed the following strategies. First, establish new EMS facilities in high-need areas. GIS layers displaying population density, AED locations, and current emergency facility distribution reveal spatial service gaps, particularly in Northeast and Southwest Houston. Placing EMS facilities in these underserved neighborhoods would reduce response times, especially where long travel distances and limited access compound emergency risks. Second, integrate real-time traffic data into EMS dispatch systems. Traffic congestion maps within the story map identify hotspots where delays will likely hinder emergency response. Incorporating live traffic feeds into routing systems would allow dispatchers to adjust routes dynamically, improving response efficiency in high-density areas like Central Houston and near major highways. Third, expand community-based alert systems like PulsePoint. Data visualizations from PulsePoint and AED coverage highlight areas where immediate bystander assistance is limited. Increasing community adoption of apps like PulsePoint, particularly in areas with low digital connectivity or long EMS arrival times, can improve survival outcomes in cardiac and trauma-related emergencies. Lastly, target digital access investments as part of the emergency planning. Maps comparing internet accessibility with demographic and emergency risk factors show that counties like B, Jones, and Walker face both physical and digital barriers. Improving broadband infrastructure and digital literacy in these areas is vital for ensuring timely alerts and communication during emergencies.
In conclusion, this story map demonstrates how geographic information systems can drive more equitable and effective emergency response planning in Houston, Texas. Through layered spatial analysis, including crime rates, EMS coverage, population density, traffic congestion, and internet access, this project identifies underserved communities that face increased vulnerability during critical incidents. By visualizing real-time incidents, AED locations, and infrastructure limitations, it becomes clear where new EMS stations, traffic integrated routing, and public alert tools are most needed. Establishing EMS services in these areas paired with expanded community preparedness and digital connectivity can reduce emergency response times and increase survival rates. As the data shows, neighborhoods on the outskirts of Houston, such as Seabrook, Katy, and Rosenberg, often lack proximity to EMS infrastructure and sufficient internet access, two factors that delay care. Bridging these gaps is not just a logistical priority, but a matter of public safety equity.
Hope you guys enjoyed our story map. We enjoyed making it, and have a great summer. Thank you.